All right, so I'm gonna go over your choking victim right now. So how do I know if someone's choking? If they're telling me they're choking, they're not choking. If you can talk and tell me you're choking, you're not choking. If you feel like you're choking, then I'm just gonna instruct my patient, just keep coughing, cough, 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 keep coughing. If they get to the point where they stop breathing, they start turning blue, they can't communicate anymore, they make the universal choking symbol. Okay, so normally they put their hands over. You're gonna take your person. I'm gonna get someone that is not hooked up to an AED. I'm going to take my person. I am going to make a fist. I'm gonna find their belly button. I'm gonna put the fist just above their belly button. My other hand is gonna go on top, and I'm gonna pull up and in, okay? You probably know this as the Heimlich, but instead, I'm gonna call it an abdominal thrust, because the Heimlich is patented. So I'm gonna call it an abdominal thrust. So find your belly button, make a fist, make sure your thumb is not on top, your thumb is around. Make a fist, you put that fist above that belly button, your other hand is gonna go on top. Do not practice this with people because it is dangerous and you can hurt yourself, okay? So I am finding the belly button, making a fist, putting my other hand on top. Then I'm gonna make a J thrust, J like the letter J. I'm gonna go up and in, okay? I'm gonna keep going up and in until they spit out the object, or they go unconscious and I do CPR. The only difference between CPR for another medical emergency is that every time you open their mouth to look for the breathing, just like you had done before, but just focusing, you may wanna try to scoop out whatever is in there once if you see it. If you do not see it, you do not scoop. If you try to scoop once and it doesn't come out, you don't keep scooping, okay? So that's what you're gonna do with an adult. And when I'm standing behind my adult, we'll pretend he has legs. So when I'm standing behind my adult, I'm gonna make sure that I have a good stance so that if he falls, I can kind of let him gently fall down and not fall on top of me. I don't wanna just stand there like this when that can cause a problem. Let's talk about a child who may be too small. If I'm a tall person, trying to do this with a child is gonna be hard. So instead, I'm gonna go on my knees, same J thrust, and I'm gonna do the abdominal J thrust. Other considerations is what if they're too large? Okay, so especially people with little arms, or there's just some people that are very large. If I can't get my hands around their waist, what I'm gonna do instead is I'm gonna put my hands around and go up at their chest. So I'm gonna do up at their chest because I can't go at their waist. The other people you do at their chest is if they're pregnant. So if they're pregnant, I'm gonna go up at their chest and I'm gonna do the abdominal or J thrust. It's not an abdominal thrust anymore, it's chest thrust. And you're doing a chest thrust because I don't want to push on the baby, okay? The last one and the most likely for you to have to deal with is a baby choking. Babies choke all the time. That is like super prevalent. You'll see so many videos of like police officers because I feel like they always have body cams for the most part. So that's where we see most of the videos come of someone saving a baby's life. Like mom is frantic, running around, finds a cop, and then they save the baby. And there's a lot of videos about that, and they're always like kind of tearjerkers if you feel like you need a good cry or good happy cry. Okay, so babies, they don't always do the right technique in those videos though, okay guys? So anytime you're holding a baby, you're gonna make sure that you're supporting their head and doing what you need to do. So if my baby's choking and I can see they're starting to have trouble breathing, what I'm going to do is I'm gonna put my hand on the back of their head and I'm gonna put their legs around my arm. This baby's legs like dislocate. So pretend that it's not backwards. So I'm gonna put their head in my arms and I'm gonna do 5 chest compressions. 1, 2, 3, 4, 5. I'm gonna take my hand right now. I'm gonna put it on the side of their head and around their mouth. I don't wanna cover their mouth. I'm gonna flip them over. Undislocate his legs. Okay, so I'm gonna flip it over. I'm gonna do 5 back blows in between the shoulder blades, and you have to hit them pretty hard, okay? So I'm gonna use the heel of my hand, and do back blows. 1, 2, 3, 4, 5. I'm gonna grab their head from the back. I'm gonna flip them over. Oh, his leg. Okay, I'm gonna flip them over and I'm gonna do 1, 2, 3, 4, 5. Put my hand right here, not covering the mouth. I'm gonna flip them over. Oh, sorry. 1, 2, 3, 4, 5. And I'm gonna keep going back and forth and back and forth. Okay, I'm gonna keep going back and forth until the baby spits it up or they stop breathing. If they stop breathing, I'm gonna do CPR. All right, that's choking. You should have watched a video about how to do CPR, how to use the AED and modify CPR for child or infants, and now how to deal with choking. I'll see you later. Go save some lives.